opening our eyes, something which we are consciously unaware. One question, the last photograph that was on your slide, it seemed quite mysterious. Could you explain the impact of that photograph?
We found it very.
It was quite interesting, but we did not understand what it was.
Probably because one eye
Reflection
two
is there, but two eye.
persons, one eye.
I could make out one was shaved, one was not shaved.
Two persons.
4 persons. They are 4
So
persons.
this is a old patient, old person with an eye, with a cornea. This is a young person. So an old person, after his death, can give that eye and give the sight to a new person.
That one needed some explanation to us also. Although we saw the photograph, since our minds did not know what our eyes saw, we did not understand the significance.
And then another person on this side.
4 persons. There are 4 faces.
4 faces, no?
Those are the
Ah,
two
there
faces.
is no
Actually,
four
the two eyes.
Two
of,
eyes,
four
and
people.
another one.
Two people.
Four eyes.
Pula,
Anyway, that could also lead to another session of lecture to understand. At the outset, I must thank Choidhary for making us aware, and what has been suggested from some of our colleagues. I think we can take out a campaign for making people aware of this gesture that they can do after their death. Only thing is to convince the relatives, because there are still some stigmas attached to donation of eyes in the body of the person, which goes for the last rites. So that, I think, a little bit of study from the scriptures has to be taken to explain to them that they lose nothing while their last journey if they give a bit of the cornea for donation. So once that has been clarified, we can take it up here, and in this auditorium we can hold sessions with the knowledgeable officers and even more knowledgeable non-officers of the railways, because our death rate is not that bad. So if it can be agreed upon, and since they are all diagnosed cases, it should not be difficult to select out who are the people who can be selected for donation of cornea. And with the Department of Ophthalmology helping us in coordinating with the eye banks, I think the donation could be done very conveniently in our hospital. We can in a big way contribute to this. Of course, if we heal patients, maybe may not be able to do it, but the trend that we are facing is we are getting the terminal cases from all the corporates in our hospital due to our very reasonable charges, and then those terminal cases can become the possible donors who do not have any contagious disease. I had just one question. We were taught that the cornea is a totally avascular structure. If it is a totally avascular structure, why is it that we are holding it responsible for carrying these diseases along with it while being transplanted?
So there are some lymphatics and nerves also. So in certain cases where if the disease gets transferred to the new
Fine. That about HIV and about hepatitis I accept, but why cancer? Cancer is a contagious disease?
No, so it's not
Metastasis,
contagious, but
lymphatic
it can
metastasis.
spread to the nerve sheaths also, because cornea is very richly
Fine,
integrated by nerves.
but do we have any documentation in literature that a transplanted cancer cell can lead to cancer in another individual?
So I have not looked up, but
So we
definitely,
are not very sure about that.
but definitely this is one of the contraindications.
And metastasis in the cornea is, I suppose, very rare.
But metastasis in the eye is common, not in the cornea.
Not in the cornea.
In the eyes you can avoid, but I think in suppose long metastasis, you have metastasis, I think in that case you
A
can.
carcinoma cervix patient who dies, why should she be
Be
deprived of
deprived
the
of
honor
it.
of donating her body? I do not know this. Maybe this will require a little bit of
Just
thinking
see the extent.
by people who matter, not like ignorant like me. Anyway, thank you. I think I have to talk a little bit about other things.